Chapter 22 Pharmacology. Let's discuss the drug names, standards, and references. Let's dive into the fascinating world of pharmaceuticals. Did you know that there are over 2,400 drugs that can be prescribed by licensed practitioners? Each of these drugs has at least 3 distinct names, and they're all regulated by the Food and Drug Administration, or FDA, which oversees their approval and sale. Now, let's break down the 3 different types of drug names. First, we have the chemical name. This specifies the exact chemical makeup of the drug. These names are often long, complex, and hard to remember. Next, there's the generic name. This name identifies the drug legally and scientifically. And here's the key, there is only one generic name for each drug. Lastly, we have the brand name, also called the trade name. This is the name given by the manufacturer. Since each manufacturer can create their own version of the drug, there may be multiple brand names for a single generic drug. A quick tip: brand names are always capitalized, like Xanax. Understanding these 3 names is essential for anyone in healthcare or pharmacy, as it helps with proper identification and usage of medications. Keep this knowledge handy, it's sure to come in useful. Let's talk about over-the-counter drugs, or OTC drugs. These are also known as non-prescription drugs, and they're designed to treat conditions that don't typically require a prescription or the care of a health professional. Here are some common examples of OTC drugs. Analgesics, like aspirin or acetaminophen, are great for relieving pain. Antihistamines, such as chlortrimetrin and dramamine, can help with allergies or motion sickness. Even some sleep aids, like doxylamine or melatonin, are available over the counter. Beyond these, there's a whole category of products you can purchase without a prescription, things like herbal preparations, vitamins, minerals, and food supplements. These are often used to support overall health and well-being. Remember, just because a drug is available OTC doesn't mean it's risk-free. Always read the labels carefully, follow dosage instructions, and consult a healthcare professional if you have any questions. When a drug manufacturer receives approval from the U.S. Food and Drug Administration, or FDA, to sell a specific drug, they are granted 20 years of exclusive manufacturing rights under a patent starting from the date of invention. Once this patent expires, the drug's generic name becomes public property. At that point, any qualified drug manufacturer can produce and sell the medication under its generic name. If a physician specifies a particular brand name on a prescription and marks it as dispense as written, pharmacies are required to provide that exact brand. No generic or alternative brand can be substituted. Here's the good news. Generic drugs are typically more affordable than their brand name counterparts, offering the same benefits at a lower cost. This makes healthcare more accessible for many patients. In the United States, drugs with the potential for abuse and dependence are closely regulated by the Drug Enforcement Administration, or D, under the U.S. Justice Department. These substances are classified into 5 distinct categories, known as schedules, based on their medical use, potential for abuse, and the likelihood of causing dependence. Schedule I substances are classified as controlled drugs with a high potential for abuse and no accepted medical use under federal law in the United States. Examples include heroin, LSD, and marijuana. These substances cannot be prescribed, administered, or dispensed under federal regulations. However, there's an important exception. Marijuana is unique in this category. While it remains a Schedule I drug federally, at least 36 states have approved marijuana for use by medically qualified individuals. Additionally, at least 17 states, along with Washington, D.C. and Guam, have legalized marijuana for recreational use. This creates a legal contradiction where marijuana is regulated differently at the state and federal levels. It highlights the evolving landscape of drug policy and enforcement in the United States. Schedule II controlled substances are classified as drugs with a high potential for abuse. Misuse of these substances can lead to severe psychological or physical dependence, making their regulation critical to public health. Examples of Schedule II substances include narcotics include morphine, methadone, meperidine, and oxycodone. Stimulants include amphetamine, methamphetamine, and Ritalin. Barbiturates include pentobarbital and even cocaine, which has limited medical use as a local anesthetic in certain procedures. Due to their potential for abuse, prescriptions for Schedule II substances are strictly regulated. They require a written prescription from a licensed healthcare provider and cannot be refilled without a new prescription. Schedule III controlled substances are drugs with less potential for abuse than those in Schedules I and II. While their misuse may lead to moderate or low physical dependence, they can still cause high psychological dependence. Examples of Schedule III substances include certain narcotics, such as combination products containing less than 15 milligrams of hydrocodone per dose, like Vicodin, as well as drugs that have less than 90 milligrams of codeine per dose, such as acetaminophen with codeine. Non-narcotics, such as anabolic steroids, including oxandrolone, which are sometimes prescribed to promote muscle growth in certain medical conditions. Although Schedule III substances have a lower risk of abuse compared to Schedules I and II, they are still controlled under strict regulations. Prescriptions require monitoring to ensure they are used safely and effectively. Schedule IV controlled substances are drugs with a lower potential for abuse compared to Schedule III substances. While the risk of dependence is lower, responsible use and regulation are still essential. Examples of Schedule IV substances include benzodiazepines, commonly prescribed for anxiety or sleep disorders, such as alprazolam, known by the brand name Xanax, as well as diazepam, marketed as Valium. These medications are widely used in medical practice, but require a prescription to ensure they are used safely and effectively. Schedule V controlled substances represent the lowest potential for abuse among the regulated schedules. These medications primarily consist of preparations containing limited quantities of certain narcotics and are often used for antitussive, antidiarrheal, and analgesic purposes. Common examples include Robitussin 80, a cough suppressant containing codeine, as well as Phenergan with codeine, used to relieve cough and cold symptoms. While these substances carry a minimal risk of abuse, they are still regulated and require a prescription or careful oversight, depending on state laws. Understanding medical terminology helps demystify how drugs are classified and used. Here are some key terms. Analgesic, a substance that reduces the sensation of pain, providing relief for conditions ranging from minor headaches to severe injuries. Antitussive, a remedy specifically designed to suppress coughing, commonly used in medications for colds and respiratory illnesses. Control refers to the regulation or correction of drug distribution and usage, ensuring medications are prescribed and dispensed safely. Formulary, an official list of drugs approved for use by a hospital or a group of physicians, streamlining the selection of effective and safe treatments. Narcotic, a drug derived from opium or a synthetic drug with similar effects, often used to manage severe pain but with potential for abuse. Let's discuss the administration of drugs. Routes of administration refer to the location on the body where a drug is applied or introduced. This classification helps determine how the drug interacts with the body and the effect it produces. In toxicology, the route of administration describes the path a drug or substance takes to enter the body. This pathway plays a key role in how the substance is absorbed, distributed, and ultimately affects the individual. Routes of administration can be categorized by the drug's intended effect. Local effects. These occur at the site of application, such as with topical treatments like creams or ointments. Systemic effects. These involve the drug circulating throughout the body and can be achieved through enteral administration, such as oral ingestion or rectal delivery. Parenteral administration, which includes methods like injections, intravenous, intramuscular, or subcutaneous. The effectiveness of a drug depends on several key factors, starting with its bioavailability, the proportion of the drug that reaches the systemic blood circulation and is available to act at its intended target site. A drug's route of administration and its formulation, whether it's a tablet, capsule, or liquid, play significant roles in determining its bioavailability. These choices are tailored to maximize the drug's effectiveness for each patient. Two essential concepts help us understand how drugs work in the body. Pharmacokinetics, which describes how the drug is absorbed into the bloodstream, distributed throughout the body, metabolized into active or inactive forms, and eventually eliminated. These processes dictate how long the drug stays active in the body. Pharmacodynamics, which focuses on the drug's interaction at its target site, S of action. It explains how the drug produces its therapeutic effects, and in some cases, side effects. Together, pharmacokinetics and pharmacodynamics provide a comprehensive understanding of how medications are designed and used effectively. Drug administration methods are designed to maximize effectiveness and convenience while considering patient preferences. Let's explore enteral and topical administration. Enteral administration involves delivering drugs through the gastrointestinal or GI tract. This includes oral administration is the most frequently used, convenient, and economical method. It's widely preferred for its simplicity. Sublingual and buccal routes is where drugs are placed under the tongue or between the gums and cheek. These routes offer a rich supply of blood vessels, allowing the drug to be rapidly absorbed directly into the systemic circulation, bypassing the GI tract. Rectal administration is using suppositories or enemas. While more common in some European countries, this method is less accepted by patients in the United States. Topical administration allows a drug to act directly at its site of application without entering systemic circulation. However, topical doesn't just refer to application on the skin. It includes ophthalmic applications, eye drops for conditions like glaucoma or dry eyes, otic applications, ear drops to treat infections or inflammation, nasal sprays for decongestion or allergy relief, vaginal or rectal topical treatments for localized infections or conditions. Understanding these routes of administration helps patients and providers choose the most effective and comfortable method for each treatment. Always discuss your options with your healthcare provider. Parenteral drug administration refers to delivering medications directly into the body, bypassing the gastrointestinal tract. This method ensures rapid and precise delivery of drugs, often for patients who cannot take oral medications. Let's explore the common routes of parenteral administration. Intramuscular route involves injecting the drug directly into a muscle. Common sites include the deltoid or gluteal muscles. Intramuscular administration is ideal for medications that need to be absorbed quickly into the bloodstream or stored in muscle tissue for slow, sustained release. Intravenous drug is delivered directly into a vein, allowing for immediate absorption into the bloodstream. Intravenous administration is the fastest way to achieve therapeutic effects, making it crucial in emergency settings or for administering fluids, antibiotics, or chemotherapy. Subcutaneous route involves injecting the drug into the layer of fat and connective tissue beneath the skin. It's commonly used for insulin and other medications requiring slower, more prolonged absorption. Intradermal drug is injected just below the skin's surface. This method is often used for allergy testing or tuberculosis skin tests, as it allows for localized and minimal drug distribution. Intrathecal route delivers medication directly into the cerebrospinal fluid via the spinal canal. It's used for spinal anesthesia, pain management, or chemotherapy targeting the central nervous system. Each parenteral route has unique advantages and specific applications. Understanding the similarities and differences among medical terms is essential for healthcare students. Let's compare buccal, sublingual, and transdermal, three distinct routes of drug administration. Buccal refers to the administration of medications inside the cheek. A drug placed in the buccal area dissolves and is absorbed directly into the bloodstream through the rich network of blood vessels in the mouth. Sublingual route involves placing the medication underneath the tongue. Similar to buccal administration, sublingual medications bypass the digestive system, allowing for rapid absorption into the bloodstream. Transdermal administration involves applying a medication to the skin. The drug is absorbed through the skin into the bloodstream, providing a controlled release over time. Examples include nicotine patches or hormone replacement therapy patches. Both buccal and sublingual methods are oral routes that avoid the gastrointestinal tract, offering quick systemic effects. In contrast, transdermal administration acts through the skin, offering sustained release over an extended period. Let's explore the accuracy and safety in drug administration. The most common route of medication administration is the self-administered oral route, chosen for its simplicity and convenience. This method is especially prevalent among older adults. In fact, 79% of adults over 65 take medications, with 39% of them on 5 or more prescription drugs. Additionally, 90% of this population also use over-the-counter medications. A large study of women over 65 revealed that 12% took 10 or more medications. 35% experienced an adverse effect from a drug. Adverse effects are harmful, unintended effects that occur secondary to a medication's therapeutic action. Additionally, adverse drug reactions caused by drug intolerance, susceptibility, or interactions with other drugs account for the hospitalization of 35% of patients in some studies. Severe ADRs can result in death, permanent impairment, or significant loss of quality of life. The opioid crisis highlights the serious consequences of adverse drug reactions. In 2018 alone, opioids were linked to 14,996 deaths, with nearly one-third involving heroin. Fortunately, the medication naloxone can block the effects of opioids in cases of overdose, offering a life-saving intervention. This data underscores the importance of medication safety, awareness of potential risks, and effective communication with healthcare providers. Administering medication is a critical responsibility that requires careful attention to detail. Before giving a drug by any route, caregivers should ensure 5 key factors are addressed to guarantee patient safety. Right patient. Always confirm the patient's identity using a bracelet or name badge. Asking for their name can lead to errors, especially in environments like assisted living where patients may have cognitive impairments. Right drug. Verify the name of the drug by checking the medication record and comparing it with the drug in hand at 3 crucial points: when taking hold of the package, when opening the package, when returning the package to storage. Right route. Ensure the medication record specifies the correct route of administration, such as oral, subcutaneous, or intramuscular. Confirm this matches the labeling on the drug. Right dose. Check that the dose listed in the medication record matches the dose of the drug in hand. Accurate dosing is essential to prevent underdosing or overdosing. Right time. Verify that the medication is being given at the time or frequency ordered in the record, ensuring consistency with the prescribed schedule. By addressing these 5 factors, caregivers can minimize errors and ensure safe and effective medication administration. Remember, attention to detail can make all the difference in a patient's health and well-being. Abbreviations in medication is essential for accurate and effective drug administration. EC. Before meals medications taken on an empty stomach to optimize absorption. PC. After meals helpful for medications that might cause stomach irritation. BID. Twice each day ensures even dosing throughout the day. TID. 3 times each day spaced evenly to maintain consistent drug levels. QID. 4 times each day used for medications requiring frequent dosing. ON. At night administered in the evening or before sleep. PO. By mouth indicates the oral route of administration. PRN. When necessary, used for medications given only as needed, such as pain relief or allergy medications. These abbreviations provide a standardized and efficient way to communicate medication instructions. Always double-check with a healthcare provider if there's any uncertainty about an order. Medical abbreviations play a vital role in ensuring clear and efficient communication when prescribing and administering medications. Let's review some commonly used abbreviations. GI refers to the gastrointestinal system, often indicating medications affecting the stomach or intestines. Stands for intramuscular injection, where the drug is administered directly into a muscle. 4. Indicates intravenous injection, delivering medication straight into the bloodstream for immediate effect. C. Refers to subcutaneous injection, where the medication is administered under the skin. B. Means per rectum, where the drug is given rectally, often as a suppository. RX. A common symbol meaning prescribe or prescription. STAT. Indicates the medication must be given immediately, often in urgent or emergency situations. These abbreviations provide a standardized language for healthcare professionals, reducing the risk of errors and improving patient care. In the medical field, abbreviations are more than just shorthand, they're essential tools for clear and efficient communication. Students must be familiar with these terms to navigate healthcare settings effectively. Let's review some key abbreviations. D stands for Drug Enforcement Agency, the federal agency responsible for regulating controlled substances and ensuring their lawful use. FDA refers to the Federal Drug Administration, which oversees the safety, efficacy, and regulation of drugs, medical devices, and food products in the United States. OTC means over-the-counter, indicating medications available without a prescription, such as pain relievers and cold remedies. USP refers to the United States Pharmacopeia, a compendium of standards for the quality, strength, and purity of medications, dietary supplements, and food ingredients. Familiarity with these abbreviations ensures students can confidently interpret medical documentation and communicate effectively in professional healthcare environments.